it is National Breastfeeding Month. Most women are physically capable of breastfeeding, but only, this is an interesting number, 36% of babies up to 6 months old are exclusively breastfed. This is according to a worldwide new study, data from 2007 to 2014. So this morning, Dr. T is here to talk about the benefits for both mom and baby and maybe some of the barriers that new moms face. Thanks for being here as always.
Oh, you're welcome. Thanks for having me. You know, there are too many barriers to moms. We know statistically most moms want to breastfeed, but there's so many things that get in the way, from our country's appalling lack of paid maternity leave, so many moms have to go back to work, to separating moms and babies, to an interesting one that most people don't realize is all the visiting that happens when a mom has a new baby. Everyone wants to see the baby, but that results in an exhausted mom, an exhausted baby, and interruption of breastfeeding. So maybe send presents, come and clean her house, but leave her and the baby to breastfeed in peace.
That is interesting. Wait until she gets in her routine and let her bond with that baby too. We all hear about the benefits, right? Let's talk about some of the benefits for mom, first of all.
Yeah, so most people don't realize that breastfeeding has benefits to moms. In the very beginning, right after the baby's born, breastfeeding will help the mom's uterus start to shrink and her bleeding start to slow. So even in that first hour after birth, we call the golden hour, we like to leave moms and babies attached to one another, in that the naked baby is on naked mom's chest and baby starts to breastfeed. That will really help mom recover from delivery. Breastfeeding also reduces a mom's risk of breast cancer in some cases, ovarian cancer, diabetes, and obesity. So they're benefits to mom's health, both at the time of delivery and in the long term.
Okay, and we hear about the benefits, of course, for baby too. Can you just go over some of those?
Sure. The biggest one is immune system. So babies are not born with an immune system that's online, so to speak. Babies share immunity with their moms through mom's breast milk. So when babies are breastfed, they continue to get whatever mom is immune to. They get many of those antibodies from feeding. So that's the biggest benefit we see in reduced infections for babies and reduce mortality for babies. So breastfeeding is literally life-saving.
We're looking at, obviously, a lot of the pros here. And you mentioned, you know, we talk about the 36%. Part of that is, you know, maybe some moms try immediately and there's no success. What are some of the tips you have out there for moms who are trying to breastfeed to make it more successful? Yeah,
so one of the things is, one, limit visitors. Two, avoid the pump in the first 4 weeks. I know moms with Obamacare, they get a free breast pump and moms take advantage of that. That is great. But in the first 4 weeks, you want to just feed baby. The reason for that is that babies are better than pumps at getting milk out of moms. And so sometimes a mom will pump and think, oh, I don't have any breast milk. But in fact, the baby will get plenty. So you want to feed the baby in the first 4 weeks to increase your supply. Our bodies make milk on demand. So if the baby's creating demand, your body will make more.
Is there an age group that you're seeing where more moms are not or breastfeeding more common than not?
We see differences across ethnicities and in younger age groups. So teens tend to breastfeed less. And that probably has to do with some of those barriers I talked about, going back to school or being busy or visiting, right?
Yes.
The teen has a baby and everyone is either helping or visiting, and that can really be a barrier, in addition to some stigma, maybe some embarrassment. So we want to decrease those barriers. Those of us who are in helping positions, physicians and moms and grandmas and aunties, to help moms breastfeed.
There really is an awareness to this, right? A factor that we need to get the word out so that especially younger moms know the benefits and understand why.
And everyone supports that woman and baby to feed.
Thank you so much, Dr. T. We always appreciate your insight.
Thank you for having me.
And I know Kylie is back there listening to this closely and taking notes, so I'm guessing we can't see the baby for a while.
I'm right here because I've got questions right after. So.
She'd like an exclusive appointment.
We'll do a consultation.
We'll do a consultation during the break. Very helpful info, though. I was taking notes.
I just heard that we don't get to see the baby for a while. We're going to leave Kylie alone.
Send presents.